So first sessions, we're kind of leading into that then of besides the standard, we're going to get all your information and sign the forms and, payments and insurance.
I was going to talk about that for like 10 minutes.
No,
it's important.
We can pass that part.
Okay.
But I think it's important, number one, to show as a therapist confidence that I know how to treat you, that I got this. Right, and I want to give them that feeling that they got it too, that they can do it, even though their anxiety is telling them run away from this guy, don't ever talk to him again. So
sure, absolutely. So how do you do that?
Well,
talk about yourself. I know you like to do that.
Well, that's true, I do. But no, I try to talk more about them actually.
Oh.
Shocker, but
good technique.
Really, kind of like what you said. Number one, I want to show that I've already treated this multiple times. That there's nothing new that they're saying to me that I've never heard before. They may be saying it in a slightly different way than I've heard before, but they're not presenting anything that's new or different or whatever than what we've seen hundreds and hundreds of times already for either of us in our clinics.
I always tell people if they can drop my jaw, then they get treatment for free.
Yeah, right.
The rest of this is just free. If you can surprise me and make me like freeze up, then you've done your job, and you're very special.
But it just doesn't happen because the themes are always kind of the similar kinds of same things. So I hope somebody leaves that first appointment feeling like this person knows me enough to help me and they're not scared of me, because the stories we sometimes hear when somebody, especially like intrusive thought OCD, who opens up to a therapist and says some of those, and the therapist gets that look of,
we start to look nervous.
No, the poker face is so very important in this treatment, and to make sure that we're projecting that the entire way and that we're showing our confidence that we really believe that this is a helpful thing for you to do, and this is why we want you to do it. I've always liked the phrase, only an Irishman can tell you to go to hell and make you look forward to the journey.
Oh, right.
And in some ways
you just happen to be Irish.
And I happen to be Irish, but we're kind of doing something similar in the fact that we're going to tell you that you're going to face the very thing that you came in here that you're afraid of, that you were probably originally hoping we would tell you. You either never have to do that again, or else we'll help you figure out a way in your life that you'll never have to face that. And yet we want to make you excited about actually going and doing it.
Yeah.
So.
And it happens.
Yeah, it really does. So it's their goals, it's their treatment. We're not, like you said, mandating or making anything happen whatsoever. And they're kind of the guide. I look at myself kind of like a coach. I've got the playbook and I've got the plays. You're the player, and you're going to run the plays that are in my playbook, right? So here's the outline. And the really cool thing I think about this, and tell me what you think too, is that from us, unless the patient requests it, there's no surprises in therapy.
Right.
I mean, everything's laid out already.
Planned out.
Yeah, it's all planned. It's all.
We're not going to add anything to your to-do list unless, again, you give us permission to do that, which some people do,
right?
Especially later on in treatment, or we've got one. It's just we have learned through our experience with them that if there's not the element of surprise, they're probably doing a compulsion, trying to plan out for it, right? Or some type of anticipatory anxiety or worry about it. And so being able to throw in things that are kind of pre-approved, but we can have a grab bag of those. That can be really helpful for people, especially those who are the perfectionists, or the need to know how things are going to happen before they even happen.
Yeah. And along with that, then, I think in that first session, we have to do a little investigation of any co-occurring issues as well, too. So assessing for depression, other anxiety disorders, PTSD, substance use, bipolar, those types of things are so very important. Probably with kids, ADHD, because where's the line between ADHD and OCD, And
lots of kids who have been misdiagnosed.
Absolutely.
Kids and teens, they come in on their meds, or they've been diagnosed as having an attention deficit. And it's not that. They appear distracted in school because they can't get thoughts.
They're obsessing.
Or they're doing their prayers. Or why did we just do that?
I don't know. Wow.
Got me with the head itch. So yeah, it is important to get a thorough assessment. We refer out if a kid hasn't had a psychological workup done. The testing. We like to get our neuropsych people on that so that they can do testing, help us rule some things out if we're really confused.
Yeah, it's definitely helpful. So we want to make sure that we're doing that, because we don't want to treat something that really isn't what we're treating. Or if there's a co-occurring issue and we don't know about it, we don't know how much that co-occurring issue is necessarily affecting the OCD or driving it in some ways or something like that too, or as there's secondary gains from one or the other. So all those things are so important to
hit a bit on. So during this first session, we're assessing for the main presenting problem or problems, because usually we don't get a nice neat I just have OCD.
Right.
There's usually depression or hair pulling or skin picking or social anxiety or something like that along with it.
Sure.
So we're gathering information about that. We are providing a lot of education. As I say, gathering education, we're gathering information about co-occurring disorders, providing education on CBT and ERP and OCD. I get up to my whiteboard and I'm drawing, and I have people take pictures on their phones, which is really nice. Now everybody has their smartphone with them, so they can take this stuff home for review.
That's great.
It really helps with the buy-in. I can't tell you how many people I've had at the end of or during the first session. It's like, I have never had anybody explain it to me like this. This
Right.
makes so much sense.
Right.
And they get excited.
Yep.
It's like, I'm terrified, but I'm excited.
Right. Yeah, finally somebody gets it.
Mm-hmm.
And it isn't just telling me to stop thinking about it or it'll just go away on its own over time or something like that.